Hello, everyone. It's Tuesday, April 14th, and this is Dr. Jennifer Freiheit, the Director of the Kenosha County Division of Health, on a snowy April Tuesday evening. An update on COVID-19 this week. We are sitting at 204 positives at the end of the day today. And our number of contact investigations, though, is on the decline. What this is telling us is that the safer at home order is working. And it took several weeks to see that it was working because as illnesses or positive cases were coming in after the safer at home order was put into place, we were still having to trace back to that positive cases 2 days before they became ill. We asked them, where were you every day for the last several days, plus the 2 days before you got your first signs and symptoms. So now that it's been several weeks since the safer at home order was put in place, we're able to now see that people are following it, that they're staying home for the most part, and that the number of close contacts they had is greatly diminished. So that is a really good sign that we were able to see that data today, that those contact investigations are on the decline and the safer at home is working. Our testing rate is still really low. We keep hearing that more collection kits will be coming to the hospitals and providers, and it can't come soon enough. We're waiting for that to happen so that we can have even better data. With more collection kits, then they'll be able to test more people. And then we will be able to get a better sense of who this is really impacting. Our hospitalization rates remain less than 20. So for Kenosha County, that has been stable at less than 20. We do, however, have our first long-term care facility that has 5 positive residents and 2 positive staff. And we're providing all sorts of resources for them and assistance, from getting personal protective equipment to helping with staffing needs. And we are really rallying behind to help them so that, and all the other facilities, assisted living, group homes, everything else in Kenosha County, to make sure that we keep these sort of instances at a minimum. So we came out really proactive before we ever even had a first positive case, and putting restrictions and limitations on these sorts of facilities to help to prevent any spread within their facilities, and we're hoping to continue that. We know that many are wanting life to return to normal, and we want that too. And the more that people follow the guidelines now, the sooner we can get back to some semblance of a new normal. And so our focus now is really on the essential workplaces. So as the contact investigations have gone down, we're really looking at workplaces, giving them education, ensuring that they're social distancing within their facilities, disinfecting, proper hand hygiene, wearing masks, that sort of thing. So we're spending a lot of resources and time to help those workplaces that are essential businesses to be able to minimize the spread within those workplaces. You may have heard on the national news that in New York City, their peak is flattening. It's not coming back down yet, but it is flattening. And I do want to just clarify that what's happening in New York, they are a month or more ahead of us. In Wisconsin, we are not where they are. And so to hear that New York is flattening, you may think, oh, we must be flattening in Kenosha County or in Wisconsin too. And we have not even reached our peak yet in Wisconsin. So the East Coast and West Coast, they were the first to have cases, and even here in the state of Wisconsin, Milwaukee and Waukesha counties got cases much sooner than we did in Kenosha County. And so within our state, Kenosha County is about a week or two behind where Milwaukee and Waukesha counties are. So I just want to caution on that, because just because the East Coast or the West Coast is seeing some semblance of flattening of their peak, it does not mean that that is equated to what is happening here. So we still must be ever vigilant. We are, however, working on projection models for Kenosha County, and I'm very excited to be able to roll these out in the next couple of days. And it's not a perfect science, but it's a best case scenario given various algorithms using the science of epidemiology to be able to guesstimate On the trajectory, we have already seen where we think our peak in Kenosha County might be. So those will be coming out soon. One thing that we're seeing is that there's no rhyme or reason as to the number of positives that we see per day. It really is all dependent on the number of tests that were given 24 to 48 hours earlier. It all depends on when the labs upload their lab results so that we get them. So it's the number of positives that come in is not necessarily a direct correlation to what's happening out in the community, just because the number of test kits is very low and the labs could be dumping a number at a certain time or piecemealing them out. And so they're, it's all just not able to give us a really good picture. But now that we have over 200 positives, we are seeing many new data points that we will be sharing with you. We've already started sharing some, and so we're excited to be able to put some data behind the decisions that we're making now for Kenosha County with the number of cases that we have had. One thing that we are seeing, this was from the very beginning with the 211 hotline, is that there is a high need for food resources and housing assistance. And this past week has been especially so with people looking for both food resources and housing assistance. And there's also a high demand for cloth masks. We know several groups out in our county are making cloth masks, and that is a good thing. And so we are hoping to get those resources where they are needed. If you are a food pantry or you have a food distribution facility or model, we hope that your information is updated on the 211 database, because people are definitely having a hard time locating resources of where to go for food and for housing assistance. There is also another way that people can help. We're in need of certified nursing assistants, or CNAs, and there are courses that can be taken to ramp up that workforce. And there's also refresher courses now for nurses who may be out of current practice or retired, and they can take a course for acute readiness if they need to jump back in the game. So those are some of the needs that we're seeing out there that the community should know about. I have received a question about antibody testing, and the FDA commissioner has stated that antibody tests are being reviewed by the agency, that they may not be as accurate as we'd like them to be. Most tests on the market have not went through an FDA scientific review, and we do not know the accuracy rate of these tests. Testing the entire community may create a false sense of safety or puts in danger of exposure with false positive or false negative results, but it's certainly something that we are planning for and that could be coming. So it's just another tool in the toolbox that we hope to utilize just as much as in 18 months, if a vaccine comes through, the health department as well will be vaccinating people for COVID, much like we do every year for influenza. So we just want to be sure that if we tell a member of the public that they are immune, that we are confident in that test. And so that is where we see things happening on the national media. Some people are testing it out because they're affiliated with maybe a research center or a university, and we are waiting those results from the FDA to know what would be a valid test for antibody testing, and we would certainly look to get that in Kenosha County. Another question I received is the fallout from the elections, and that is an answer that we won't have for a little bit. Should there have been any spread during people who had voted in person last Tuesday, they may not see symptoms for up to 14 days after the election. So it could take potentially 2 weeks for symptoms to even show. And even then, so they may present in some people as mild, people who would never normally go to the doctor for such mild symptoms. And it could take another 2 weeks after that for people to potentially get sick enough where they need to present at a hospital or with their doctor. So we're tracking certainly every single case that comes through us now if they were at the in-person voting last Tuesday, but we won't have really good data for that for 2 to 4 weeks to see if there was any impact from that face-to-face voting, in-person voting last week. There was a second shipment of personal protective equipment. 8 more of our emergency medical services received PPE. 2 hospitals and 6 long-term care facilities all received the Strategic National Stockpiles personal protective equipment. I don't know exactly how many, but it clearly is not enough that we need to fully fulfill everything, but at least we are getting some more in Kenosha County. You may have also heard about the Milwaukee County Alternate Care Facility at State Fair Park. That is something that they are hoping will be open next week, and we are waiting for that guidance to see what that would mean for us in Kenosha County if the hospitals reach a certain capacity or they need to discharge people but not quite yet to home. Could we use that alternate care facility to house people there if necessary? And so more guidance will come out. They're looking to be open next week, and we will certainly share that when we have that. So we know that many are wanting, life to return to normal, and we want that too. And so we are trying to do as much as we can for education so that we can dispel the rumors that we're seeing out there right now. That was one of the things we've heard a lot this week through our contact investigations is that there's a higher degree of panic and anxiety now. This has been going on for a while. People are nervous. They want to know when they can get back to normal. And so we're working to dispel those rumors through a variety of methods. We have been producing through our Joint Information Center Friday videos, and these videos cover the top 10 facts that have been received through our website or our phone line or our COVID-19@kenoshacounty.org email address. And we're addressing these every Friday through a video. It's being posted on the county webpage, and it's also being posted on the Kenosha County Health Facebook page. So I would encourage you to keep checking at the end of each Friday for that video that can be shared, and also on the Kenosha County Health Facebook page. And this page is important to follow because it will, that's where we post any recent updates that we can get, especially from the State Health Department. More is coming about the fishing season opening, camping, farmers markets, auctions, garage sales. All of those things we're used to participating in the spring and early summer. And the State Health Department will be putting out guidance on those. And as soon as we have that guidance, we will be able to share that far and wide through social media and through regular media means. So that is a good way in between these Tuesday broadcasts to be able to keep up with what is going on through the media. And that is the report for this week. And I'm going to check to see, I see that there is a last minute question. Let me read that here. What should a person in our community do if they are concerned that a business is still open to the public but may not be considered essential? So this, we get many of these calls a day. And so we are following the CDC guidelines as far as what is an essential business. And we can certainly do some education or follow up to see if that business is in fact deemed as an essential business, and help to educate them on the importance of whether they need to remain open or to potentially close. And we can also help them with any education as far as social distancing and masking and that sort of thing. So we have received a number of those sorts of emails and calls to our health department, and we have been able to follow up on all of those. I think I see, I don't know if that was the same question there. All right, let me just check my other source for any other questions here. And I'm receiving word that that was the only question. So thank you all for joining me again, and I appreciate all of your partnership and feedback. We've been getting great feedback from all of you, and I'm eager to help any of our partners out in any way. Been doing many talks with businesses and workforces and to be able to allay anxiety, educate, and be able to reach out into the community. And so anybody having a need for that, we certainly are open for that, and we're making ourselves available. As back, I think 4 weeks ago, I told you one of our main missions was education about COVID-19 for our county. And so we are available for that, and we have enjoyed being able to dispel some of the rumors and allay some of the fears. So thank you very much, and I'll look forward to talking to you again next Tuesday.